Hello everyone, today's topic is a nutritional perspective on Mulberry heart disease, which is a prevalent issue in swine production field. I heard an interesting story from a friend who works as a swine nutritionist in a feed company. He regularly receives some complaints from swine producers about the lack of vitamin E and selenium in their diets. So we sat down to hear more about the story. The swine producer checked on the pigs in the morning and noticed some nursery pigs died overnight. So he called his vet, explained the situation, and asked him to come and diagnose the dead pigs. When the vet did a necropsy, he found the fluid was filled in the pericardium and checked the heart, liver, lung, and other organs. Regarding all the clinical signs, he diagnosed the reason for pig deaths as a Mulberry heart disease. And then he gave an explanation to the swine producers that Mulberry heart disease is a nutritional disorder due to vitamin E and selenium deficiency. And then he gave a solution for this Mulberry heart disease. The solution was increasing the vitamin E and selenium content in the feed and supplementing a vitamin E and selenium supplements directly either in the feed or through drinking water sooner than later. So the swine producer asked the feed company to check the vitamin E and selenium levels in the diet with the explanation of the Mulberry heart disease outbreak in their farm, and asked to increase those levels in the diet too. However, when the feed formulator or swine nutritionist receives such this asking, the swine producer's request is somewhat confusing for them because they formulate the diet with higher dosage of vitamin and minerals that that were already 3 to 5 times higher than the NRC requirements. In general, feed formulators and swine nutritionists are formulating swine diets with higher levels of vitamins and selenium through VTM premix supplementation than the NRC requirements or pig breeder recommendation levels. So, why did Mulberry heart disease happen? Is the sudden death diagnosed with Mulberry heart disease really caused by a lack of vitamin E and selenium? First, let's talk about Mulberry heart disease. According to the University of Minnesota Swine Disease Library database, Mulberry heart disease is a nutritional disorder due to vitamin E and selenium deficiency, and it causes sudden death and cardiovascular modification in nursery-aged pigs. According to the Iowa State University Swine Disease Manual, it also says Mulberry heart disease is an overlapping syndrome associated with vitamin E and/or selenium deficiency. Iowa State University's Swine Disease Manual also indicated that high concentrations of polyunsaturated fatty acids, copper, vitamin A, or microtoxins in feed can either destroy vitamin E or make it less bioavailable. Grains from soil deficient in selenium or a selenium antagonist in mixed feeds can result in feeds low in selenium. Both vitamin E and selenium work as antioxidants. There are three close related overlapping syndromes associated with vitamin E and/or selenium deficiency. The most common symptom is Mulberry heart disease. Interesting statement is true causal mechanism is not known, but there is a significant relationship between vitamin E and Mulberry heart disease. Typical clinical signs of Mulberry heart disease are an increased amount of clear fluid in the pericardium and multiple areas of hemorrhage on the surface of the heart that looks like Mulberry. The heart looks like the following pictures: paintbrush lesions on the surface, hemorrhaging myocardium inside of the heart. University of Minnesota Swine Disease Library database says injectable vitamin E and selenium products are available and effective in preventing Mulberry heart disease and be careful not to cause selenium toxicity. In the same context, the Iowa State University Swine Disease Manual says supplementation of vitamin E and selenium through feed and drinking water can prevent this Mulberry heart disease. Besides, they noted that if treated with iron dextran for anemia prevention, many deaths might be occurred due to Mulberry heart disease, and myocardial lesions would closely resemble those of Mulberry heart disease. So my question is, does vitamin E and selenium deficiency directly cause Mulberry heart disease? Why are extra vitamin E and selenium supplementation the way to treat and prevent this Mulberry heart disease? Shen and others 2011 published a paper titled Vitamin E and selenium levels are within normal range in pigs diagnosed with Mulberry heart disease, and evidence for viral involvement in the syndrome is lacking. They aim to determine the levels of vitamin E and selenium and 13 other trace minerals in heart and liver tissues, and to determine the prevalence of certain viral infections in heart tissues from Mulberry heart disease affected and Mulberry heart disease unaffected pigs, and the vitamin E and selenium concentration in feed samples from selected farms with Mulberry heart disease pigs. Mulberry heart disease in pigs is characterized by regions of acute hemorrhagic myocarditis and myocardial necrosis. There is no difference in selenium level in heart tissue between Mulberry heart disease lesion-positive pigs and negative pigs. The positive pigs showed lower selenium levels in liver tissue, but both levels are in the normal reference range. When they analyzed the vitamin E level in heart and liver tissues, the negative pigs group showed a higher number of pigs with deficient levels of vitamin E in heart and liver tissue. Authors also found that none of the pathogens detected in this study could be linked to Mulberry heart disease, because there is a possibility that the virus could cause lesions similar to Mulberry heart disease, since there are a number of viruses in humans that have been shown to cause heart lesions in humans. Furthermore, these viruses also cause selenium deficiencies in the infected human, such as HIV or Ebola. They also discussed that the data were not strong enough to point to a definitive pathogen associated with the Mulberry heart disease, but they point out that the link between certain viruses in humans and their associated clinical signs such as selenium deficiency that are common to Mulberry heart disease. Another article was published by Helke and others in 2020 who were developing a novel surgery model of pediatric hypoxia in 10 to 12 kilogram male farm-raised Yorkshire piglets. The study reported that the index piglets died suddenly approximately 16 to 18 hours after surgery. When the necropsy, this pig revealed clear pericardial effusions along with myocardial hemorrhage and hepatic lesions consistent with Mulberry heart disease. The vitamin E and selenium concentration in the pelleted feed were higher than the pig's nutrient recommendation. Lab A received the serum samples and then resends them to Michigan State University for vitamin E analysis and also sent them to the Utah Veterinary Diagnostics Lab for selenium analysis. Lab B is the Iowa State University Veterinary Diagnostics Lab, and they analyzed both on site. Serum vitamin E and selenium levels from this pig were below a reference range in Lab A, but the serum vitamin E and selenium levels analyzed by Lab B are in the reference range. Through this case study, they reported that the vitamin E and selenium deficiency may not always lead to Mulberry heart disease. In addition, Mulberry heart disease can occur in young pigs with normal vitamin E and selenium levels, or in piglets with decreased hepatic vitamin E and normal selenium levels. Interestingly, they raise a surgical stress issue in this paper, which could result in decreased antioxidant activity, which has also been associated with Mulberry heart disease. Then, when these swine vets get the evidence that Mulberry heart disease is caused by vitamin E and selenium deficiency, according to the book titled Disease of Swine, 8th edition, published by Iowa State University Press, Mulberry heart disease is mentioned only once in the chapter of nutrient deficiencies and excesses. In the table titled Signs of Vitamin Deficiency in Swine, vitamin E, sudden death, cardiac muscle degeneration, Mulberry heart, referred from NRC 1988, Mayan 1991, and 1994. So I look up the Mayan 1991 reference. Dr. Mayan was a professor at Ohio State University. He was known as a big guy on vitamin E and selenium nutrition in swine. Mayan 1991 is a swine nutrition book chapter, Vitamin E and Selenium in Swine Nutrition, written by Dr. Mayan. In this chapter, he described the signs of vitamin E and selenium deficiency, such as liver deterioration, hemorrhage, and heart tissue abnormalities. And he also mentioned increased fluid accumulation in the pericardiac sac, which is considered a major clinical sign of Mulberry heart disease. Let's remind what we have looked at so far. Vitamin E and selenium deficiency could cause clinical signs of Mulberry heart disease, such as an increased amount of clinical fluid in the pericardium and multiple areas of hemorrhage on the surface of the heart. When the sudden death of pigs is diagnosed with Mulberry heart disease, supplementing additional vitamin E and selenium through feed or water prevents the extra sudden death of pigs by Mulberry heart disease. However, Mulberry heart disease does not always show decreased vitamin E and selenium levels in pigs' blood and tissue. If they are infected with unknown disease or viruses, high oxidant stress occurs and relevant pathway requiring higher dosage of vitamin E and selenium are highly activated. If so, wasn't the higher dosage of antioxidant from the dietary vitamin E and selenium working effectively under the disease-infected condition in the pigs? Many human clinical studies report the effect of high dosages of vitamin E and selenium on human patients, especially those with cancers. In practice, many cancer patients have gotten immune boosting shots containing high dosage of vitamin C, E, and selenium. Regarding these ideas, let's think about the vitamin E and selenium deficiency in pigs fed a diet containing enough vitamin and mineral levels. When a pig gets a virus or disease, it causes an immune response leading to increased oxidative stress. As vitamin E and selenium are used in pathways that reduce free radical activity, and as their requirements increase, the concentration of vitamin E and selenium in blood and tissues may fall below the reference level. Furthermore, after necropsy, the pig would be diagnosed with Mulberry heart disease, and as a solution, additional vitamin E and selenium treatment would work to prevent potential sudden death by fulfilling the extra needs of vitamin E and selenium in pigs. So today's take-home message is Mulberry heart disease does not always mean vitamin E and selenium deficiency in pig's diet. We need to check the potential risk affecting vitamin E and selenium content or activity in the diet. And also we need to check the possibility of other disease or virus infection in the pig herd. Thank you very much for your time and attention. If you have any questions or additional thoughts on this, please feel free to leave a comment so that we can continue the discussion about this topic.